You're watching TVC Breakfast. Now, vision plays a significant role in life, impacting many areas such as education, employment, and recreation. According to the World Economic Forum, out of the global population of 7.7 billion, an estimated 2.5 billion persons suffer from vision impairments. It is also believed that 30% of children suffer from poor vision, which inherently affect their long-term learning ability. The World Health Organization lists poor vision as one of the top 3 leading causes of disabilities in the world. Many individuals who suffer from poor vision are unable to access eye care or are unaware that they might need it. Joining us from Abuja studio is Dr. Anderson Chimeziri, President of the Nigerian Optometric Association. Together we'll explore. Thank you so much for joining us. It's important for us to explore this important topic as we, mark today talking about the World Sight Day. That's what it is. Yeah, thank you, Olamide. So, what is the significance of looking at this crucial topic, especially as it affects students? When you talk about the eye, the eye phenomenon.
We mark the World Sight Day world over. It's a program that is set aside by the International Agency for the Prevention of Blindness and the World Health Organization. The theme for this year is emphasizing on vision for children. And we can caption it vision for the future, vision for the young, vision for kids. And it's very, very important based on 2 key points. One, we consider blindness in terms of blindness years. Children have the highest number of blind years. If you consider that a child becomes blind at the age of 12, and the average lifespan is about 55, so the child is going to be blind for 48 years. Every other eye condition that leads to blindness happens most times, especially in the adulthood. Maybe somebody gets cataract at the age of 60, and then he lives up to 80, that's 20 years. So that's the emphasis. Then secondly, we are talking about assault in the early childhood that determines the visual status of the person in adulthood. That is to say that most assaults in early childhood could be the reason why the child, or where the person will have some difficulties in sight at adulthood. And then we also look at the fact that the youths remain the productive sector of the population. And if this set of the population are affected by visual impairment, then it affects the productivity of the nation. And that's why it's very, very important to focus attention on children and the young to make sure that no one is needlessly blind. And we're talking of blindness, we might be looking at a small ratio, but when we talk about the huge burden of visual impairment, that is the inability of the individual to make optimum use of the sight, then it becomes a very big problem for the Nigerian population. And then we also talk about the fact that there is increasing visual demand, and there's also exposure at early stage. During our days, before you enter the primary school, you have to do your hands like this and get up to 6 years. But now a child of 1 year is already interested in reading, in the computer, in games. I have a very funny story of a child that is just 6 months old, and the mother brought 2 phones. One was an Android phone, and the other one was an analog phone. When they gave the child the analog phone, he threw it away. They gave an Android phone, and the child was busy screening, moving the screen and was laughing. That is to tell you the level of exposure that we are having now in terms of increased visual demand. And then children also get closer to the screen, unlike the days of our cathode ray television where we stand afar. But today we have laptops and phones that have brought very close to the eyes. So that shows the increasing burden of visual conditions. And that's the reason why we are using this opportunity to create the needed awareness to help our younger population so that they can preserve their sight and also take care of their eyes.
All right, thank you for mentioning the exposure factor. Well, I would like you to explain to us which has more effect. Is it the role of genetics, the environment, or really the use or the exposure that we see today?
Yeah, both are very, very important, both the exposure and also the early exposure is there, and then also the ergonometrics, that is the environment where we find ourselves. I mentioned the issue of bringing the system, the laptop, the phone closer to the eyes, and also being exposed early, and also longer time spent on the system. We term these things to be what we call computer vision syndrome, because the eye grows, and from childhood it continues to grow. So the more you are exposing this, the eyes to near objects, then the likelihood that a child will develop a near sightedness problem, which we call myopia. And that's why we're having a very high prevalence of myopia in the current generation, because of the increased exposure to digital devices, which are brought very close to the face and to the eyes. And these are issues we need to create awareness for and make the children and the parents understand how to handle this situation and make sure that we have children that are having healthy eyes.
If you talk about access to eye care services, that's a serious problem we are also facing, in most part of this country, or in this country, compared to what we see in other countries. But there are challenges regarding the availability of pediatric eye specialists and affordable treatment. So how can we bridge this gap so that we will have quality access to eye care? Because a lot of people will just say, okay, just put eye drop or use something to wash your eyes, and then in the process, so many people lose their vision.
Yeah, access to eye care, accessibility, affordability, and the quality of service are three important factors that determine the coverage and determine the effectivity of eye care delivery in Nigeria. When we talk about access, we don't really need super pediatric specialists. The optometrists are the primary eye care providers. And by the grace of God, Nigeria produces the highest number of optometrists in Africa. Presently, we have over 7,000 optometrists, but the problem is the distribution. There is maldistribution of these eye care workers, majority of them concentrating in the urban areas because of remuneration and also incentives. So a lot can be done by the government to see that incentives are given to eye care workers to be able to work in the rural areas, because the burden, the concentration of the prevalence of visual impairment and blindness remains in the underserved area, the rural areas, and up in some areas, and which cannot be easily accessed. Now imagine if I go to a rural area to set up my practice, and I'll find it difficult to survive. So I would rather go to the city where there is level of literacy and awareness existing there. So government can do a lot by what we have proposed, having an optometrist in each local government. One optometrist or two in a local government can cover the local government area and be able to have satellite clinics in the various wards. And by so doing, we can assess this, we can provide these services to the population, to the society, and bridge this gap in terms of coverage, in terms of accessibility. And then in the area of affordability, I thank the Federal Ministry of Health, and I thank the government, the President of the Federal Republic of Nigeria, for the waiver that has been granted on pharmaceuticals and medical devices. And we are seriously urging that optical devices, lenses, should be included in those in that waiver, so that people can have, the community and those need glasses can get it at very affordable prices and affordable costs. So that is a way that government can also address this issue by creating waiver for ophthalmic equipment. Some of the ophthalmic equipment, the one I use, I bought it in 2014 at the cost of $950. Now you can get it for less than 5.7 million. And that also increases the cost of the consultation and the services that are rendered. But if we have waivers on this equipment, it's possible that the cost of consultation and the cost of this examination will be cheaper. And then also we have the glasses without VAT, without import duties. We as an association wanted to import some glasses for free distribution, and we were meant to pay close to like 20 million to bring it into Nigeria. And then how can you give these things free of charge to the communities? So government need to come in to include optical devices and devices used in ophthalmics in the waiver that is being gazetted through the magnanimity of the president, and that will help us a lot to reduce affordability of eye care services.
All right, before we talk about the cost of consultation and the role health insurance plays in the number of people who actually present themselves, even when they see the symptoms to the doctors, let's talk about some of the challenges in that sense, in detecting eye problems in young persons, especially in resource-constrained areas. You mentioned earlier that a number of persons facing these issues are in the rural areas. What are the things that parents should see, especially for young persons? I mean, children that cannot even speak, to detect a eye problem?
Yeah. If I get you right, we are looking at that very specifically. One of the things we have initiated from our association is what we call My Sight, My Right. My Sight, My Right is an initiative that we have conceptualized to render free screening eye examination for children every second Friday of the month. In this World Sight Day, on the 11th, which is this Friday, we are going to open up our facilities to examine children free of charge and give them glasses and medications free of charge. And having told you that optometrists are more spread than any other eye care professional, so we have been able to reach out to the communities in this project. So far, we have screened over 50,000 children for various eye ailments and have given them glasses and medications. And apart from that, we engage in outreach services. Every of our state chapters are embarking on screening services in the various communities. So we reach out to the various communities to ensure that these children that are in the communities are, sought after. We call it to case finding. We find them out and then refer them to the base clinic and then be able to attend to them comprehensively. Then we also have what we call the school eye health program. Right now, we are training teachers in the various schools, especially in the rural areas, to detect these eye problems. So we are mounting vision corridors in all the schools where the school eye health teacher can subject these children to visual acuity tests. And once she notices or he notices any deficiency or suboptimum vision, he refers the child for effective examination. And these things are done free of charge. And then we're also mounting a lot of campaign in the radio, in the televisions, and in all the news media to create that needed awareness. And some of the awareness messages we are talking about, especially in terms of wearing sunglasses. We are wearing sunglasses, especially blue-cut sunglasses that prevent the harmful ultraviolet rays from entering into the eyes. Now, in Korea, these glasses are being given free of charge to every child in the various schools. And when they use them to prevent the harmful blue rays, not only from the sunlight, but also from these electronic devices. We also advocate for taking screen break time. That is what we call the 20-20-20 rule, where you have to limit the time of the duration of exposure of the eye to digital devices. That means you have to take a break after a while, because most times children keep watching video games for 3, 4, 5 hours at a stretch. So parents should learn how to limit. When the child gets exposed at a particular time, you say it's okay, enough, or you have a rest for the eyes, and then you continue. We also talk about the same thing in terms, Yeah,
of course, I know you can go on, and I would say kudos to you, for all of the things that you do. But most importantly, the only time most Nigerians tend to have access to, some of these eye care facilities or, different kind of programs usually when we have, during the electioneering period, where we have politicians who are sponsoring, in collaboration with different eye care services or ophthalmologists or optometrists and all of that, issuing out eyeglasses, treating cataracts and other, visually or visual problems that people tend to have, or eye problems that people tend to have. But what kind of, if you consider the growing number of children who are having eye health issues, what role do you think the government can actually do, and in collaboration or maybe with health organizations, the role they can play in creating policies or frameworks that support both eye care or support better eye care for young children, as against what we tend to see, during the electioneering period? That's when the only people tend to have access to this.
Yeah, thank you very much. That was exactly what I was actually trying to emphasize before now. The most important thing that makes a system work is institution. If there are strong institutions, most of our healthcare will not be dependent on charity or philanthropy. And that's why I say that's need for government to mobilize optometrists in every local government. It's not a big deal to have one in every local government, stationed in those local governments, and pay them adequately. And then they will be able to establish eye centers in our various primary healthcare centers. And maybe possible.
But in the face of brain drain that we're having in the country, how do you think, what kind of policy can, the government is trying to retain doctors, now you talk about optometrists, and we really do not have many of them in the country. A lot of them are actually wanting out of the country. Do you think we are doing enough to hold them back into the country, incentives and all of that, for them to be able to be readily available to service the people?
Yeah, well, brain drain is a real factor. In our last conference, we actually discussed that in details. But I believe also that government can do a lot in terms of remuneration. But most people are living, the essence of the whole brain drain is all about fortunes, money, all about, having a better life. And I mean, if the government can do something to improve remuneration, improve the working conditions, I don't think most of us, like personally, I can't jump out to anywhere because the younger ones. So sometimes you go to our various hospitals, you see the consulting room. You begin to wonder, is a human being working here? This is the reason why people go out there. It's not just all about the passion to work in Nigeria is there, but the working conditions are very, very poor. That government need to improve on that. I mean, if you give me a very nice consulting room with air conditioning, with steady lights, and you're paying me well, what am I going out there to go and do? So in terms of the optometry profession, we have schools that are producing enough doctors, and they are ready to work. Very, very ready to work if the working conditions are really improved. And I don't think it will really affect us in that sense if the working conditions are looked into by the government.
All right. So it's one thing to, access care. It's another thing to access the right care. You mentioned the blue light earlier, the photochromic glasses and all that. If you go online, you see so many persons selling different form of glasses. What's the association doing to ensure a reduction, at least, in the number of quacks that we see outside today?
Yeah, thank you very much. We are doing a lot, but I mean, this is a big menace. It's a monster that has really affected the healthcare industry. It's not just in eye care, it's everywhere. You see people on, I don't use the word quack, but untrained and unqualified persons rendering services. It's happening everywhere. And we have our regulatory bodies that are working hard, battling to curtail this menace. And one of the strategies that they have adopted is, especially in the area of those who pose themselves as opticians and technicians. So our regulatory agency has tried to regularize that area to bring them to formal training, so that we remove them from the market, we remove them from the shacks, and turn them into regulated profession. In that way, it will help to curb the menace. One problem is that the most dangerous person is an uninformed healthcare service provider. When they are properly informed, they will render qualitative services. But when they don't know what they are doing, and they keep propagating practices that are very, very dangerous to the society. That is a very big problem. So we need to bring them out, maybe give them a kind of formal education, and when they are more educated, they will be able to know their rights and the limitations on what they can do. That's part of what we are trying to do.
Right. President of the Nigerian Optometric Association, together we'll explore. Thank you so much for your keenness of insight, Dr. Anderson Chimeziri. Thank you so much for your time.